joining me today and allowing for you taking the time to watch this. I want to express my sincere interest in your quality and safety manager position that you have posted. I believe that my experience and skills will be a good marriage for this position. My name is Anjanette Techmeyer. I have been a nurse for over 10 years, and I have experience in not only nursing but also in leadership. My education has been in nursing but also in organizational leadership. I believe the skills and the knowledge that I have will be a good fit for your organization. I've viewed your mission statement as well as your vision, and I absolutely am on board with those things. What I'd like to start out by telling you is that I am very passionate about quality and safety. It is something that I learned as a new nurse on the floor. I saw some things that I didn't know were not being done in the correct way. I thought this was the way that it was done everywhere. I understand that you don't work in an NCLEX hospital when you come out of nursing school. However, there were things that were being done that were not above board, so to speak. After having been in the nursing field for several years, I've been able to look back at that time and really evaluate what was happening and why did I not feel empowered as a nurse to say what I knew was wrong, not only to my peers but also to my supervisors. And that's really what I want to talk to you about today, because in my philosophy, I believe that as senior leaders, it is our responsibility to build the culture within our organization so that our nurses, brand new or seasoned nurses, never feel that they cannot say what they need to say. If they are concerned about quality of care that they're providing, quality of outcomes that they're seeing, or in anything that is related to safety, potential safety issues, definitely we want to hear about. But what that culture needs to do is it needs to allow these nurses to be able to have conversations freely and be free of having any retribution because of that or retaliation. We need to have a zero tolerance of retaliation, and that means even jokingly or kiddingly. And that's what culture is. Culture is not a destination that we get to. Culture is a destination that as leaders, we are in charge of helping nurture that as a growing being. And so that is something that we can't forget. We can't get locked in our offices looking at data and numbers. We have to be what I call boots on the ground. And boots on the ground means that, if I'm talking about something that happened in the surgical suite, I know what the surgical suite looks like because I've been there. I've walked it. I know how far this table is from this. And so I can't learn about safety and quality within your organization if I can't have boots on the ground and be able to have conversations with staff and help develop that culture that I think is so important as leaders. I have had experience in leadership and leading quality and safety metrics for probably the last 8 years. I served as a manager in a clinic, and I improved all of our quality and safety measures while I was there. I did not improve those. I helped facilitate that improvement. I currently work as a medical services reviewer, and what I do is I look at medical records. I look at them from a nursing standpoint, but I also look at them from a quality and safety standpoint. And I'm on the quality or the fraud, abuse, and waste committee. And within that committee, once I joined the committee, my role then expanded because of my role of being a medical services reviewer. And the cases that started coming to me were more around drug diversion. It's something that I was a passion, I expressed a passion to the committee on. They turned it over to me, and within about 3 months, we had investigated I'm going to say several cases, and with that we also developed some procedures and policies that we implemented within the Colorado region as well. We've actually improved our medication error rates significantly by changing the way that we require documentation to be done and where that documentation is done as well. I believe that medication diversion is definitely a high patient safety area of concern, and I believe it's the responsibility of every employee at every level, pharmacy, physicians, and nurses, as well as our CNAs or our medical receptionists, because they often see things that you and I in our office are not going to see. And we want them to be able to, again, freely be able to report anything that they see that would lead to possible diversion, just so an investigation can take place. One thing that I did notice is that your website that people report these instances or concerns on, for me, seems very cumbersome, and it seems like it's not very easily used. What I also realized is that doing some research on your company is that from your recent employee survey, your employees don't feel that upper leadership has been timely in their I want to say response or active investigation. Now, obviously, employees are not privy to that information, but we do need to have some sort of two-way conversation so that they know that we're aware of it, that they know that we're working on it, and they need to have that that sense of trust that that is happening as well, because that's part of building the culture and building that safety net. We don't ever want our employees to stop talking to us. That is our number one way that we know what's happening within our facility. I have such a great passion for medication administration, and in my spare time, I serve as an instructor at a licensed practical nursing school, and I enjoy teaching brand new nurses a new skill set that they didn't have. But more importantly for me is teaching them the sense of responsibility. For me, I think medication administration, that is one of our the hot topic issues, as far as I think patient safety is at most risk during this time. We can help patients greatly by the medications that we give. We can also harm them greatly by the medications that we give, or in a diversion instance by the medications that we choose not to give as well. My passion for safety and quality is so strong. I feel that I am a perfect candidate for this position. If you feel that I would be a good fit, I would welcome the opportunity to have a further discussion about this. You have my contact information. Please give me a call. I would love to meet you. Thank you so much. Have a great and safe evening. Thank you.